Hi, welcome back to my channel. In this video, I will be discussing the CAP classification of varicose veins, which is a commonly asked question. So first of all, you should know that CAP. So basically, we have four components. All right. So CEAP. So C stands for the clinical classification. All right. Then we have E, which stands for etiologic classification. A stands for anatomic distribution. Then P stands for pathophysiologic classification. Alright, so let's start from the first one, which is clinical classification. Now you have till 0 to 6. Alright, so this is our this is C component. Now here you have C0, C1, C2, C3, C4, C4A and C4B, C5 and C6. So C0 is no visible changes or signs. Alright. Now C1 is telangiectasia, reticular veins. C2 is varicose veins. C3 is edema. I will tell you through photograph also. C4A is pigmentation or eczema. C4B is lipodermatosclerosis, or we have atrophy. C5 is healed venous ulcer. C6 is open venous ulcer. Now let's talk about the etiological. Now in etiological, you need to know that there are four things. So E, C, E, P, then E, D and E, N. Basically, you have to just think about the etiology. So either it can be congenital or it can be primary, right? So I'll just write the short form: primary, secondary, or there can be no etiologic cause can be made out. All right, so then coming on to anatomic. So A. Now A, you just have to think about which all veins it can affect. All right, so it can affect the C. First of all, just think about all the veins it can affect. So it can affect superficial veins, it can affect perforator veins, right? Then it can affect the deep veins, and then there can be no vein association. So a superficial AS, perforator P, deep D, no N. All right, then pathophysiologic. Now in pathophysiologic, basically P. So you just have to remember two things. All right, so either it can be reflux, or it can be obstruction, or it can be reflux and obstruction, and then no pathophysiology can be seen. So now let's talk about the photograph, through which we can basically just learn nicely. So this is the photograph. So let's just see the photograph. So first of all, here we can observe that first one is CO. So basically what was CO? CO was when no visible sign is can be made out, right? Then coming on to the second, which is the telangiectasia or the reticular veins. Okay, so telangiectasia or reticular veins. Then severe form of it, varicose veins. Then more severe, edema. Then 4A and 4B. First you can observe pigmentation. Then you will see lipodermatosclerosis. Now here usually one question is asked that inverted champagne bottle appearance is associated with. So you should know that it is lipodermatosclerosis, right? I'll just write it in bold form so that it's visible. Lipodermatosclerosis, change in varicose veins, right? So this is the question. Then C3 is basically healed venous ulcer, and then C6 is open venous ulcer. Alright, this is like the clinical. Then we have etiologic here. Now etiologic, congenital, primary, secondary is post-thrombotic, and then N is no venous cause can be identified. Then AS is superficial, D a perforator, deep, and no vein location identified. Then just remember two things, RO. So reflux, obstruction, then reflux and obstruction. Alright, so this is it. This is the the diagram which is like in clinical picture if you have to see. Same thing only. So first of all, just revise again. C0, no visible changes, like this is perfect. Then this is perfect, right? Then coming on to C1, telangiectasia, so you can observe here, right? Then we have varicose veins. You probably know varicose veins till now. Edema, this is the edema, right? Then pigmentation, or you can see eczema. So this is it. Then healed venous ulcer and active venous ulcer, basically open venous ulcer. All right, so this is the CEAP classification which is asked, and I hope I made it easier for you to understand. If you